Age-related macular degeneration, or AMD, is the most common retinal degenerative disease, and there is currently no cure. The retina contains 5 distinct types of neurons, which are wired together into one of nature's most bewildering circuit boards. This circuitry is kept healthy by a thin layer of cells called the retinal pigment epithelium, or RPE. Once these RPE cells are damaged, they don't regenerate, meaning they can no longer support the photoreceptors. When the photoreceptors here start to die, detailed vision needed for tasks like reading begins to disappear irreversibly. The most advanced area of research involves replacing damaged RPE cells with new cells created from stem cells. And there are 2 main approaches currently in clinical trials. The first involves injecting a suspension of these new stem cell-derived RPE cells directly into the retina. Clinical trials on 4 patients have reported some early success using these pre-formed sheets, with 2 patients reporting improvements in their vision. The use of sheets of cells in clinical trials, researchers in the lab are making progress recreating fully formed 3D miniature retinas. One day, these mini retinas might be a one-stop shop for new transplantable retinal tissue and cells, including photoreceptors.
Now, veterinarians have access to utilize this cutting-edge treatment strategy in their practice. As we age, our stem cells' response to injury and ability to repair can decrease or be overwhelmed due to disease. Degenerative disease such as osteoarthritis can overwhelm your pet's own natural repair process, leading to pain, inflammation, and limited mobility. Osteoarthritis has a long-term impact on the patient by causing loss of cartilage and accelerated lameness. Adult stem cells have the ability to rebuild and regenerate cartilage as well as repair.
Stem cells do is they have a couple of properties. One is the ability to renew themselves. They can regenerate and create new stem cells. And the second property is that they are pluripotential, which means they can differentiate into other cell types. Stem cells are present in high concentrations in the bone marrow and lesser concentrations in other tissue like liver, skin, muscle, and they are deployed when we get injured or when degeneration.
High-dose chemotherapy followed by an autologous stem cell transplant using your own stem cells is an important treatment option for younger and/or fitter myeloma patients. Stem cells are collected or harvested by a process called apheresis, in which blood is taken from one arm and passed through a cell sorting machine. This separates out the stem cells, and the remaining blood is returned into a vein in your other arm. The harvested stem cells are mixed with a preservative and then frozen in liquid nitrogen until the time of your transplant. The next stage involves treatment with high-dose chemotherapy. This is usually a high dose of melphalan given intravenously, with the aim of removing any residual myeloma cells you have following induction treatment. However, as mentioned before, the melphalan can also destroy normal healthy cells. Your previously collected stem cells are reinfused back into your blood, where they make their way back into the bone marrow. The transplanted stem cells then begin to make new blood cells. This vital process, which effectively rescues your bone marrow, is known as engraftment. High-dose chemotherapy followed by an autologous stem cell transplant using your own stem cells is an important treatment option for younger and/or fitter myeloma patients.
Stem cells are cells that are undifferentiated, meaning they do not have a specific job or function. While skin cells protect your body, muscle cells contract, and nerve cells send signals, stem cells do not have any specific structures or functions. Stem cells do have the potential to become all other kinds of cells in your body. There are actually multiple kinds of stem cells that scientists can use for medical treatments and research. Adult stem cells or tissue-specific stem cells are found in small numbers in most of your body's tissues. Tissue-specific stem cells replace the existing cells in your organs as they wear out and die. Embryonic stem cells are created from leftover embryos that are willingly donated by patients from fertility clinics.